Keith Crowley hopped on the roof to fix some shingles last December and slipped.
I fell from the corner of the roof right there, and I landed on this corner post right here on my chest and struck the ground, head of my...
Just right here. Huh?
Yeah, right there.
What was supposed to be a simple roof repair turned into the beginning of a physical and financial nightmare.
It was over quick, you know, and it was painful. I'd struck my head, and so I was bleeding a little bit, and the neighbors came across the street to tend to me, and I believe I was probably unconscious for a short period of time.
Keith felt okay, so he drove himself to the hospital. But it didn't take long before he knew something just didn't feel right.
My condition deteriorated quite rapidly, and they put me with my head down and my feet up, and of course there was a scramble around me. The alarm bells were going off on the monitors, and the nurses started scrambling into the room, and they put IVs in both of my arms, and of course a catheter in my bladder and oxygen on my face.
Turns out Keith had a severely injured spleen. After being treated right here at West Branch Regional Medical Center, Keith needed to be transported here to Covenant Healthcare by helicopter for their specialized services. In just minutes and a little over 60 miles from West Branch, he arrived by helicopter to Covenant Medical Center in Saginaw. Keith's daughter, Erin, feared the worst.
They're flying him. And to me, that means my dad's getting flown. That's obviously really bad.
And it was pretty bad, but Keith was treated and back on his feet in just a couple days. That's when his financial nightmare began. He got this bill in the mail from the helicopter service, MedTrans. Check it out. Now, Keith owed more than $34,000.
What was it like to get this bill in the mail?
So I didn't think much about it, you know. I figured, okay, no problem. We have insurance. It'll all be covered.
But he was wrong. His insurance only covered about $8,000. He still owes over $25,000.
So what was it like finding out that you have to pay this? I mean, you have family expenses, you have other financial obligations.
There's no way that I can just pull $25,000 out of my pocket or my bank account and give it to them to pay it.
The I-Team wondered, what if this happens to you? You're hurt. Docs say you need an air ambulance to get you to the trauma center.
So were you ever given the option of being transported a different way besides the helicopter?
The doctor just came in and said, I'm calling a helicopter.
So the question is, can you refuse the helicopter if you're alert and of sound mind, knowing you're going to rack up a huge bill? Well, yes, but beware at your own risk.
It's a tough situation because air medical transport is a very effective medical intervention, but it's not appropriate for every patient. Where it is most appropriate are in those very time-sensitive, life-threatening situations.
Get this, every year about 550,000 patients in the U.S. are flown by a medical helicopter for emergencies. Now that's according to the Association of Air Medical Services. And a flight to the ER can get pretty pricey, like Keith's $34,000 ride. So here's what you need to know. First, a good rule of thumb, know your insurance inside and out. Read the fine print.
You're in this life and death situation. I wonder if anybody ever thinks to ask, you know, is this covered?
That's why you need to know which services are covered before something happens.
There are a number of programs that have what they call membership programs that for a small fee every month, and I don't know what the fees are, you can join a membership program that will cover the full cost of an air medical transport should you ever need one. That's in a sense paying for a transport ahead.
Since Keith's air ambulance flight was not fully covered, is he stuck with the bill? Sherlock suggests working with the air medical provider to help resolve the situation quickly. They can help you advocate with your insurance company.
No air medical program in the United States or anywhere around the world wants to see a patient put in the financial crisis because they've just had a medical crisis.
I'm sure you have advice for other people going through this similar situation. Ask them questions.
Boy, you better really understand that these services are incredibly expensive, and if they're not covered, you better be prepared to make a decision in these situations for you or your family member.
Keith says this ordeal, well, it has taught him a very expensive lesson.
Without a doubt, I would have refused to go on it. You know, there's no question.